Okay, so first thing that we're going to do is we're going to assess the range of motion of someone's lumbar spine. So I'm going to get the patient, first of all, to slowly bend forward to me and running your hands down your thighs. All he does is I'm looking at shoulder blade height and whether it slightly rotates one side or the other. This could help indicate any sort of scoliosis. And coming back up nice and slowly for me. Throughout this, we get the patient to stop as soon as they feel any sort of range and get us to pinpoint exactly where it might be. The next thing I'm going to get the patient to do is put their hands across their chest. And I'm going to get them to slowly lean back for me. Through this, we can have a look at if there's any sort of muscle guarding or increase in pain or tone through the paraspinals. Is there any pain there for you? No. Essentially what we're doing here is we're going to be looking, and the main thing is facet joints and whether there's any sort of pain. Leaning forward for me, nice and slowly. The next thing we're going to be doing is I'm going to get Mike to look to your left for me, your whole body for me, nice and rotate. Any sort of pain or issues with that? Good, and we're going back the other side. Good. So one thing that your patient might do is actually not rotate through their lumbar spine, and they might just rotate essentially with their trunk. That's because the trunk has more inclination for rotation, less than extension. The next thing I'm going to get you to do is pop your hands down by your side. And can I get you to take your right shoulder down towards the ground and slide your hand down your legs? Any sort of pain with that? And coming back up. And now the other side. Same thing, we're looking at how much range the actual lumbar spine is moving and checking that we're not just hinging at the thoracolumbar junction, and coming back up. All of these tests, essentially what we're doing is checking the amount of movement that is available and whether the certain directions close down on any nerves and the patient feels any sort of pain.